I've measured MPO or galectin or whatever over the years, but the result comes back abnormal. What do I do with the results? And Michael, I'm looking forward to our discussion about this in more detail, but I guess what I would say is you can start seeing, based on how we calibrated these tests, to identify individuals that have actionable findings, together with linking up the outcome measures, for example, with the CVE assay, with the outcomes of clinical trials of various drugs that have been recently examined. Those folks with low scores with CVE, we're obviously going to always maintain prevention, but we want to think about the intensity of that prevention, including statins, as well as other therapeutics that might be used, blood pressure control, et cetera, the more conventional, lesser aggressive approach. Anyone with intermediate or higher scores, those are folks that, depending on the presence or absence of symptoms, we would tailor the therapy accordingly. For my patients with intermediate scores, I go high dose potent statin. If they've got hypertension, I begin to more intensively monitor them. I will refer them for physical therapy and rehab for diet as well as exercise counseling. And furthermore, I link up the CADhs score. For my diabetic patients, I will initiate across the board SGLT2 inhibitors and GLP-1 receptor agonists. Again, I'll remind you that the endpoints in all of the trials for those two classes of diabetes drugs was triple MACE, which is the same endpoint that was what the HART CVE was developed against. And then for those with higher scores, particularly those with atypical symptoms, that's where I will reach for further testing. So it allows me to tailor the use of the higher intensity evaluations as much as is possible. Now, the other thing that gets asked is, well, can I get the individual biomarker scores? And you can, and that also might help for those that are biomarker weenies like me who understand these things, to tailor based on the individual markers. Of course, for NT-proBNP, we've got a whole toolbox now at this point for how to manage elevated natriuretic peptides. But it turns out there are data looking at, in randomized fashion, the effects of drugs like ARBs on osteopontin, statins on TIMP1, as well as KIM1. Interestingly, there are some data now looking at SGLT2 inhibitors and KIM1 elevation. So we're rapidly coming forward with an even more individualized approach using the various markers that are present.